Hello and welcome back to Dr. Carri's Clinical Corner. And today we're going to talk about why Kegels are not enough for overactive bladder. So, overactive bladder is kind of a general term, also in my mind synonymous with bladder urgency, bladder frequency, like feeling like you always need to go to the bathroom. And so oftentimes people think I just need to do more Kegels, and that's not always the truth. They think like, oh, if I do more Kegels, I can make it to the bathroom without leaking. So bladder leakage is maybe a little bit different than this, but usually people are afraid of leaking, and that's why they go to the bathroom a lot. So those two things can happen together, or you could just have overactive bladder. So a couple reasons why Kegels are not enough. Number one, maybe you have tightness in your pelvic floor. So let me just show you. This is a model of the bladder, and it sits in the pelvis. So for a female, it sits in, so here's your pelvis. It sits right in the front here. It's kind of hard to see because it's all red, but it sits right here in the front. And so if we look from the bottom, it's all pelvic floor muscles. And if we look from the inside, all that red on the bottom is pelvic floor muscles. So they're surrounding your bladder. So let's say my hand is the pelvic floor muscles and the bladder is in here. If our pelvic floor muscles are tight, they're always going to be pushing on this bladder, making it feel like I need to go to the bathroom. Or could be both, but it also could just be not allowing this bladder to fill up to capacity. If there's always pressure on it, then the bladder thinks I need to go. I'm full, I need to empty, right? Or maybe I can't fill up more. So that's the number one reason maybe Kegels aren't enough. So if you already have tight muscles, we don't need to make them tighter. Number two, when we go pee, some people that have overactive bladder, not everyone, but they don't feel like they completely empty. So again, if the muscles are tight, when we go to pee or poop, the muscles should relax so everything can empty. But if the muscles are tight and they don't fully relax, then maybe this gets cut off before it's fully empty. And number three, sometimes it's just habits. So some of my patients, they come into the clinic for overactive bladder, bladder urgency, bladder frequency, and we test their pelvic floor muscles and it's completely normal. And so then it's habit. So this is a hard plastic model, but our bladder is very soft and squishy like a water balloon. And so it can expand to hold urine, and then it contracts when it's empty. And what happens is when it's like about 40% full, we get a signal like, oh, a sensation that like, oh, I need to go to the bathroom, but not yet, it's not urgent. But like, I gotta start thinking about it. And then when it's like 80% full, we get a strong signal like, I need to go to the bathroom now. And what happens is if we go to the bathroom every time we get that first signal, then our body thinks the bladder's full. And we go and it becomes a strong signal. So the signals sort of get mixed up. And then what can happen over time is that does become our bladder capacity. The bladder shrinks because it never fully gets stretched out. So a normal healthy bladder can hold 2 cups of urine, which is a lot. And for males, maybe 2.5 cups. And so we need to sort of rewire those signals to give the proper signal for the proper amount of urine. And then over time, we need to expand that. So Kegels have nothing to do with this. So usually my patients in the clinic will test all their pelvic floor to see, is there any tightness? Is there any weakness? Is there an endurance issue of the muscles? Like they just can't hold on. And very often, more than 50% of the time, the pelvic floor is essentially normal. So what we need to work on then is your habits. And because I kept seeing this over and over, I created this online course because I'm like, you don't really need to see me or anyone in person. It's just habits. So you could take the free introductory course to learn a few tips to start. And then if you like that, you could take the full course, which has like 30 videos, a bunch of different scenarios, tells you how to track this, how to like increase your bladder capacity, how to change the signal, all of that. So yeah, Kegels are not the full answer to overactive bladder. And one other thing I will say is usually the medication for overactive bladder, the side effect is constipation. So some people, the medicine helps them, but other people, it doesn't have any effect, or for some people it helps them, but the constipation becomes more of an issue. And when we're constipated, here's the rectum. Let me just show you. So they kind of sit in the pelvis like this. So if the rectum is always full, it's always going to be pushing on the bladder. So again, constipation is not going to help you in the long run, but we need happy bowels, happy bladder. So check out my free course, introductory course. Take it, there's no obligation, and just see if it helps.